Here along South Division, in the heart of the 49507, is an organization that has been the heartbeat of this community for the last 25 years, serving the underserved, lifting them up, Exalta Health. And that's why we're putting them in our Connecting with Community spotlight.
We perform a service that anybody in the neighborhood can get.
Through the halls at Exalta Health.
I'm trying to get a party for when he leaves.
Past the physician rooms.
So this is just pretty typical stuff.
Beyond the dental chairs.
Sandra is our hygienist.
Outside of optometry and telehealth.
You know, another service that's just invaluable.
There are two qualities that run throughout.
See, I'll come back and visit a lot.
Oh, that's frightening.
The passionate care delivered with a smile, and the dedication the team has to their mission to serve.
We truly are here to show God's love to anybody who may not have experienced that. We can do it in a tangible way. We treat the whole person, mind, body, and spirit. We have 2 doctors. We've got a nurse, 2 medical assistants, full-time dentist.
Exalta Health exists to serve the uninsured, underinsured, and refugees.
There is a tendency within the Hispanic community and also within the Black community. There are people who will not go to a clinic or will not go to a physician. We have a little over 1,100 primary care patients in medical, over 1,000 in dental, and then we have about 500 that do both.
They rely on a team of 50 dedicated volunteers that commit their time and expertise each month.
These are scribes, they're nurses, they're dental assistants.
And have more than 120 students who receive clinical experience each year.
MSU places us here in this amazing clinic.
And for each of them, success has a twofold meaning.
So if you think about it, here you got a young fellow comes, or a young lady who comes out of say Guatemala, who's never seen a doctor a day in their life, never seen a dentist a day in their life. And they walk through these doors and they're going to sit down with somebody who's going to ask them a lot of questions and stick needles in their arm. That can be frightening. But if you think of the success of that, it's actually getting those kids to come back and to be able to get additional treatment because they're scared.
Over 60% of their patients are uninsured. 22% receive Medicaid. All have their own reasons or fears for not seeking medical help.
We're going to go in and go door to door almost to try to provide some knowledgeable stuff about health. We'll do some education. We may do some care within the home. You know, it's going to take some building of trust because some people don't come here because of anecdotal stuff that they've heard their entire life, or, you know, fear of not being documented or something of that nature. Regardless of all the stuff that goes on about that, the important thing is that they're still worthy of getting good medical care.
And there is the other fold, worthy of care, a dedicated mission that has raised Exalta Health to where they are today in West Michigan.
If people can see who and what we are, that's what success is. If we're truly showing God's love, that's what success is. That's all it has to be.
The organization says that they are always looking for skilled volunteers, medical, dental, behavioral health, or really anybody who has free time on their hands who's looking to help. Or they say there are other ways to support their mission, financially or through prayer. For News 8, I'm Casey Jones, putting Exalta Health in our Connecting with Community spotlight.